rushed to an emergency hospital in order to calm down the pain until the next day. I don't believe that we want to expose our child to this bad experience. Another reason why should we keep milk teeth is to avoid having malaligned teeth or uneven teeth. Uneven teeth erupt when the permanent teeth erupt. There is normal shedding time for the milk teeth, and in this normal shedding time, the permanent teeth will be replacing the milk teeth in their places. So the idea of losing milk tooth very early in life, this will lead that the permanent teeth will be missing their guidance, and then they will be malaligned or overlapping each other, which means that it's necessary to send our beloved child to later on in life, maybe by the age of 14 or 15, to align these teeth to a specialist, and this may involve removal of one or more teeth. Another reason also why should we keep milk teeth is that to avoid mental trauma. We don't want to expose our beloved children to mental trauma and bad experience with dentists, or even having extreme pain, which is meant by the dental pain. Also, we want to keep a healthy relationship between the dentist and the child, in the sense that they have to have rapport, and we don't want the child throughout life to avoid dentists. Why? Because if the child is exposed to bad experience and mental trauma and dental pain while being child, then I believe that it will turn the child off from visiting dentists later on when the permanent teeth erupting. So the idea of not taking care of milk teeth cannot be entertained. Why? Because one chance was given. If it was lost, then even the second chance have more tendency that it's lost. But let's little bit digress into what are the tooth components. As we see in the diagram, this is one of my favorite diagrams, by the way. It's which is explanatory, self-explanatory by itself, and we can see that the main three components of the tooth. Just forget about the gum. Let's talk about the tooth itself. The tooth itself is composed of three main components. The outermost component, which is white in color, is what we call as enamel, and this is what we see in when reflecting in the mirror when we look at ourselves, or when we just look at our peer. So this is enamel. The beauty about this enamel layer is that it's absolutely painless, which means that it doesn't contain any nerve innervations, and nor it's having any nourishment at all. So the first layer, which is enamel, is white in color, doesn't have any nerve endings, so no feelings is there. On the opposite hand, we do have the innermost layer, which is the nerve. And as the name indicates, that it's nerve means feeling. So it's highly nourished area and full of nerve endings and highly sensitive. So totally opposite to the first layer. The middle layer, which is sandwiched between the enamel layer and the nerve or the pulp, is what we call as the dentin, which is yellow in color. It's having both features of the outermost layer, the enamel, and the innermost layer, which is the pulp. Which means that somehow in certain areas the nerve, the dentin will be maybe not sensitive in certain areas, but while approaching to the pulp or the nerve, that's the time this dentin layer will become more and more and more sensitive. So we got it, three layers, the outermost layer, the enamel, innermost layer, which is the pulp or the nerve, and the middle layer, which is the dentin. Now, let's hop into the dental caries stage. Of course, there are stages for dental caries. It doesn't happen just sudden. There are three processes for the dental caries as of the layers. Let's see this diagram. Yeah, it's an interesting diagram. I love this diagram, by the way. The first initiation of dental caries, it starts by invading the enamel. Maybe it's by discoloration of the enamel, then followed by cavitation. Then cavitation means the decay is breaching through the enamel layer. At this stage, since the enamel layer, as we mentioned earlier, that doesn't have any nerve innervations, no nerve endings, so there's no pain as such. So the child does not have any kind of pain, despite the fact if we visit the dentist by chance and the dentist mentioned something about your child, for example, is having dental caries, maybe the parents as well as the child, maybe they will deny that and will think that the dentist is just over exaggerating. But the first layer, if the decay is there or the dental caries is there, absolutely there will be no pain. The bacteria will continue breaching, but through the enamel layer, and this time the process will be much faster than before. Why much faster? Because the food debris will start accumulating into the hole, and basically it's covered from all the sides. So it's covered from all the sides, from all the instruments, all ways of cleaning the mouth and removing food debris. So because of the food fermentation and the presence of the bacteria, the bacteria will continue digging through the enamel layer. And in the third picture, we can see that it's almost approached the dentin layer, and it breached through the dentin layer. And that time, in the third picture, number 3, that's the time the person will be having some sensitivity initially when the decay just breaches the dentin. That's the time the person or the child will be experiencing some kind of pain, in the sense that sensitivity for cold, for hot, maybe also for sweets. If the matter is not attended and the hole is not buried, then that's the time the decay will continue reaching throughout to the nerve. And this is almost near the last stage. Why? Because there are some other complications later on. But at this stage, in the fourth picture, that's the time the bill will alarm. And that's the time most of the parents, they just come to know that their child is having dental caries. And that's the time they rush to the dentist. And at this time, of course, I mean, the child will have to have some kind of analgesics or analgesia, whether Panadol or Brufen or any diclofenac or any sodium or any kind of analgesia. And then they rush to the dentist. Parents rush to the dentist at the last stage. When they reach to the dentist, that's the time the dentist maybe will declare to them that there are 3 ways for treatment. Either the dentist will agree to do dental filling if the cavity is not deep, did not reach to the sensitive parts of the tooth, or did not reach to the nerve, or the dentist will suggest removal of the tooth. And if the parents are against removal of the tooth and they want the pain to be disappearing, then that's the time the dentist also can suggest root canal treatment. And what we mean by root canal treatment is just simply denerving the tooth, which means that we have to remove the pulp of the tooth, the pulp which is the last picture, which is red in color. That's the nerve which we have to remove in the root canal treatment process. And the tooth then is left only skeleton and without any feelings. But what can lead that our children will have dental caries and reach to that extent? In my opinion, dental caries risk factors are many. Okay, but I will just cut them to the main ones, in my opinion. But what do you think? What can be the causes of dental caries in children? I summarized maybe whatever I want to say in this table. And as you can see, I put in the first category, number one is less milk dairy. As we all know, that children are in the growing stage for their bone or their teeth. And for this, they require like cement, like ready mix. Okay, what's the ready mix for the body? Is calcium and phosphorus. So we have to nourish the body of our child with milk and milk products. Otherwise, it doesn't mean that our kid will not grow. They will still continue growing, but the growth of the bone as well as in teeth will be disturbed in the sense that the formation will not be as strong as the ones which are having a lot of milk and phosphorus. A second, also simultaneous factor to keep in mind is vitamin D. Vitamin D is an important factor, an important vitamin in order to metabolize and to make use for our body for milk and dairy products. In the sense that if we have milk or dairy products without having vitamin D, then that's the time the body cannot process the milk, and despite the fact we are not, our body will not, our child's body will not make use of it, and then it will not be processed and deposited in the milk or in teeth. A third reason why should our child have dental caries is less oral care. Most of parents whom I receive on daily basis, that they believe that they believe that the idea of just brushing teeth for kids' teeth is not tolerable and not entertained. Why? Because anyways these teeth are going to be replaced. However, if we don't teach the child at early age to take care of something which is called teeth, okay, then later on also they'll be ignorant to take care of the permanent teeth. What we have to know also, that scientifically proved that it's about 80% of the child's personality formed by the age of about 6 to 8 years. So if we train the child to take care of their milk teeth, then automatically by default they are going to take care of the permanent teeth, which is going to last them lifelong. However, if we don't take care of the milk teeth, then by default also they will not pay attention for the permanent teeth, and they will have issues later on. Another reason why should we have also, why should our kids have dental caries is sticky, sugary food. And I believe most of our children are indulged into sticky and sugary food, in the sense that these are pretty harmful for the teeth. Why? because simply the tooth is not a piece of wall.